We're now going to move on to Tariq Khan. Now, Dr. Khan practices in the UK as a consultant podiatrist and is the director of the Marigold Clinic, University College London Hospitals. So I'm going to hand the mic over to Tariq.
Hello, everyone. Lovely to be here. I'm probably the first person that you've come across that isn't talking about a particular type of therapy. I'm actually an organization. As much as I think I am one, I'm probably not. I'm going to talk to you about podiatry. So podiatry is something that you may have heard of as people dealing with feet. Well, we are specialists. We're specialists of the lower limb. Basically, podiatry has been around for centuries. Podiatry basically looks at many facets of the lower limb. I'll start just telling you a little bit about myself. As Naveed's already mentioned, I'm a podiatrist. I'm based at the Royal London Hospital for Integrated Medicine, currently on a sabbatical, living in Australia, which is very nice. The department's been there for 30 years. I trained as a conventional podiatrist and have had interest in homeopathy, acupuncture, and phytotherapy or herbalism. My role with the Royal College of Podiatry is I am the lead in special advisory group in complementary and integrated medicine. And what I'm going to talk to you about is how, as a profession, we have integrated over the last 40 years certain modalities as part of our treatment regime for our patient groups. So what is podiatrist? Well, podiatry is basically a primary aim to improve the mobility, independence, quality of life of our patients. Podiatrists specialize in the foot, the ankle, and the leg, leading to the patient through a whole journey, including prevention, diagnosis, and treatment. Podiatrists can work in a variety of workplaces, working with healthcare professionals like doctors and nurses, and also can set up on their own and work by themselves. There we go. I'm moving. There we go. What do podiatrists treat? So we treat a large amount of different types of conditions. So something called hallux rigidus, where there's pain in a limitation of movement in the big toe joint, toe deformities, aging feet, athlete's foot, blisters, bunions, chilblains, verruca pedis, corns and calluses, gout, heel pain, ingrained toenails, osteoarthritis, rheumatoid arthritis, sweaty feet, and flat feet. So there's a host of different things that a podiatrist can look at. We're very comprehensive in all those areas. And what I've actually focused on here is showing you how other aspects of the complementary therapies you've heard about already. So Mike has given you quite a comprehensive idea of what acupuncture is. Tony has spoken to you about homeopathy. Chris is going to go into depth about herbal medicine. I'm going to show you what we target. And when we see any patient, we look at them like any therapist at what they have as their primary podiatric problem. And sometimes they may come with a foot pain. They may come with a lesion on their feet. They may come with referring pain, so talking about knees and hips and necks and so on. And our job as podiatrists is to review their podiatric needs, look at them holistically from head to toe, and gauge where the problem is coming from. For some condition, like the musculoskeletal ones, it tends to be bringing together what we call a biomechanical assessment, and we can measure different parts of the joints from their feet all the way up into their lower back to assess the amount of movement a muscle or a joint is placing on a particular area. In the case of skin lesions, we will look like dermatologists do. We will use devices to look at a particular lesion, whether it's a wart or whether it's a fungal condition of the skin. And basically, we then integrate that as part of our everyday program and then bring in the appropriate complementary therapy, which can aid a modality of how we treat. So as Mike already mentioned, areas that particularly in podiatry we use, is osteoarthritis. Joint pain is a big problem that we see. Metatarsalgia or Morton's neuroma. This is pain in the ball of our feet. Plantar fasciitis, your plantar fascia starts just below your toes all the way down to the base of your heel. Achilles tendinopathies, these seen in a lot of sports people. Back of your ankle, the big gastroc muscle inserts into your Achilles tendon and inserts into your plantar fascia. Myofascial pain, peripheral neuropathy, spasticity, and rehab injuries. So what does dry needling offer? I guess in many ways, it's applied as a treatment for pain, and it's been around for thousands of years. Techniques today are probably not that different from what was mentioned by Mike earlier. Empirical evidence suggests that local needling in an area of pain and dysfunction is effective. All practitioners who treat MSK dysfunction would find the technique of needling trigger point or local acupuncture point useful, but adequate knowledge of anatomy and infection control is very important in that. So a podiatrist wanting to use the modality of acupuncture would go to a body and train. And our College of Podiatry would be focusing on making sure that their scope of practice was in line with the profession of podiatry. And places like BMAT and other colleges of acupuncture would offer then the training for our practitioners to use. The next area I'm going to talk about is herbal phytotherapy in podiatry. So herbal medicine or phytotherapy is the use of fresh herbs and plant materials applied either topically or used as a tea or made into a tablet for internal use. The practice of Western herbal medicine in the UK has traditionally provided treatment from ailments of the whole body. Herbal preparations are licensed products in the UK and are regulated by MHRA. So the uses and benefits of herbal preparations in podiatry date back all the way to 1971 by a couple of gentlemen called Rosenau and Halliday. They introduced a pharmacopoeia for podiatrists, or chiropodists as they were known then, and implemented the use of certain herbal flowers. Ruta, thuya, rosemary, and hypericum are probably the most well known. Hypericum, also known as St. John's wort, has properties which affect nerve tissue and help with nerve pain. Ruta, often combined with arnica, is used for joint pains and inflammation. Rosemary used for pain and soreness of the joints. Thuja used for antiviral activity to treat warts. Tea tree for antifungal activity. The evidence base is minimal in podiatric medicine regarding these things, but the wealth of studies, both in vitro and vivo, have preparation shown to have significant results. The one I want to really talk to you about, and which has been well established, is something called marigold therapy. This, in the 1970s, Dr. Tariq Khan introduced marigold therapy in the field of podiatry. Marigold therapy has been used 40 years in the United Kingdom and evaluated by numerous randomized double-blind placebo-controlled studies on various skin issues and of the lower extremity. Various species of marigold are naturally antiviral, antifungal, keratolytic, anti-inflammatory when these are applied topically to an area. Marigold therapy offers a non-invasive, gentle treatment for difficult treatments of plantar verrucas, hyperkeratotic lesions, and inflamed bursae. So, marigold tagetes. Marigold therapy was first described in 1980. The Tagete species of marigold has been found to be strongly keratolytic. The keratolytic and anti-inflammatory properties of the Tagetes in the treatment of verrucas and hyperkeratotic lesions have been documented for many years. Tagetes has also been described as a treatment for carbuncles, eye infections in India, as well as joint pain and muscular spasms in Brazil and Mexico. In addition, of being a treatment for verrucas, the species has also been used for allergic contact dermatitis and as well as radiation dermatitis with breast cancer. In contrast, the English pot marigold calendula has been described for the treatments of cuts, wounds, and ulcerations since the 1830s. Recently, antimicrobial, anti-tumor, antioxidant properties of calendula have been established and utilized in researching treatments for various cancers. The species has also been found to have hepatocytoprotective properties in the treatment of CC14 poisoning, as well as antimicrobial properties. In recent years, investigators have studied properties of calendula in healing diabetic foot ulcers, and so on. So here are some lovely pictures for your afternoon tea to mull over. And I share this because this is probably the most important thing I can show you visually, befores and afters. So the first patient on the left with verruca pedis, this has been a potential passion and love for me for the last 30 years. I did my doctoral thesis on warts and their treatments, and you can see this individual has what we call a recalcitrant wart of verruca, which has been present for over now best part of 10 years, multiple treatments conventionally used, and unfortunately this started off as a little lesion which then grew, and this is a series over 12 weeks, and you can actually see at week 2, which is the second picture along, it's bleeding, which means the virus is still alive. By the 3rd week, which is the 4th picture down, it stopped bleeding when we actually debride it. By the 3rd week, what we actually have is regeneration of tissue. And by 12 weeks, we have a normal foot. So those are the benefits of using something which doesn't have a side effect and is actually quite effective in the management of a very difficult viral disorder of the skin. The next one along, fibrous neurovascular corns. Corns are pressure lesions. We all get corns because we may wear ill-fitting shoes, or there's pressure management on the soles of the feet. And often these simple corns are easily dealt with using topical agents, moisturizing, and wearing supportive shoes or insoles. Unfortunately, when you get something called a neurovascular corn, it's actually deeper in its impact. It's affecting the local neurons and nerve supply and leads to scarring of the tissue and immense pain and inflammation. So again, this picture shows a patient over 3 months, previously having 6 years of conventional just podiatry treatment without true benefit. And we were able to resolve the lesion and actually help the skin to go back to normal. Above top, we have soft tissue inflammation. Often inflammation can form into what we call a sac of fluid called a bursitis or synovial fluid around a joint. So this can be rubbing and friction, again, in line with the plantar fasciitis, Achilles tendinopathies, and so on. So again, here, after 7 days, you can actually see a clear reduction in the soft tissue inflammation around the joint, and also leading to the removal of pain. The next one, which is very common at the moment, fungal toes and traumatic toenails. Here we can see actually all of the toenails are affected for many, many years. One of the biggest problems we have conventionally to manage these is a lot of the antifungal drugs are very toxic and can damage your liver and have to be monitored. So it is not an option for everyone to use. But what we are able to offer, as you can see, over a period of 5 years, is the nail actually improving, the fungus disappearing, and regeneration of a new nail. And this, unfortunately, nails are one of those things that take a very long time to heal. They can take, on average, 9 months to 2 years to grow. So if you're constantly getting trauma and reinfection, it's a very difficult condition. And then the last area is these very chronic wounds. So we do see a lot of these rarer, deep neuropathic ulcers, which are managed by our diabetic teams in podiatry. But we also see a lot of rare diseases as well. And that's another area I focus on, conditions like epidermolysis bullosa, or EB for short. These are the butterfly kids, where they're born with their skin falls off, as well as the pachynychias and the keratoderma type patients. So we can offer a modality to manage all of these sorts of cases. So in summary of sort of topical herbal preparations, they definitely have a significant benefit in the treatment of podiatric conditions. The longevity of their continued use in podiatry over the past 40 years has provided the podiatrist with a valuable tool to integrate into everyday practice. So podiatry, homeopathy in podiatry, I won't go into the overview of homeopathy because I think Tony actually explained that beautifully. But to go into what sort of areas of homeopathy are used in podiatry. So homeopathy, as Tony's mentioned, is a lot about taking remedies orally, but there are cases where there are actually potentized remedies used topically. And some of the ones that you may have come across or heard of, for instance, Tromil has been around for some time and used in the sports world. So a study back in 2013 actually showed that a multi-centered, randomized, blinded, controlled, and non-inferiority trial, try saying that after a few drinks, to determine Tromil versus diclofenac, which is a known pain anti-inflammatory agent for reducing pain and improving ankle mobility with acute ankle sprain. The results showed Tromil ointment and gel decreased pain and improved joint function to the same extent as diclofenac in acute ankle sprain and was well tolerated. Arnica is probably the one name that I think everybody knows and has been in the world of homeopathy as a first line remedy. It's used along to treat with muscular trauma and bruising. Studies have shown positive indication of its use for treating muscular pain. But a systematic review, placebo-controlled clinical trials carried out by Ernst claimed that homeopathic arnica isn't as efficacious beyond a placebo effect, and it's not supported by rigorous clinical trials. Some pilot studies that have carried out in podiatry have also shown that a pilot study with just 10 patients assessing the benefits of Ruta, which is known as RU, at 30C potency given orally in the treatment of plantar fasciitis. So 2 groups were measured in a conventional podiatry manner. They were given orthotics or insoles. These are to correct the pressures of the arch and the heel as one walks, which is why you will get plantar fasciitis. And one was given active and the other placebo Ruta to take orally. The results were positive and very beneficial in outcome for in the active group and less so in the placebo group. But again, a larger study would be required, a more randomized control way of managing. Other areas where homeopathy has been used in the treatment of skin conditions have been viral warts and verrucas, and they have shown effects on lesions in placebo-controlled trials, and often most of them have been superior to placebo. Numerous case studies have been shown also to show good long-standing lesions like I have shown you today. So to conclude, it can be concluded homeopathy can be a part in podiatric care, but requires further studies and efficacy of application in podiatric conditions. So what I'd like you to leave you with is, as a profession, as podiatrists, our members are all regulated and trained and are everywhere in the country. And all of us have many interests, from the point of surgery to pediatrics to dermatology, elderly care, rheumatology, and so on. And what we as a body and as a group is try to offer support to our members if they wish to have training and be able to use these tools as part of their everyday practice. And I'm pleased to say, as a member of the college, we have many different teaching modalities available for our podiatrists to learn all these techniques. And by no means what I have said to you today about the 3 main things that have been in podiatry, that also other many areas such as reflexology, chiropractic or mobilization techniques, osteopathy, they're all been part of us and integrated for many, many years. So I feel as the Royal College of Podiatry, we actually show a very unified way of integration for our patients' care. I hope that's okay. Any questions, please let me know.
Tariq, thank you very much for that amazing and interesting talk. We've got a couple of questions here, some specific. So, are there any specific recommendations for patients with diabetes that you can offer to prevent foot complications?
Absolutely. If anyone would like to go to the Royal College of Podiatry webpage and actually have a look on there, there is a whole diabetic area of prevention. So things that you can start doing, whether it's how you cut your toenails, when do you apply certain types of creams and ointments, and what are things that you should avoid. Footwear, that's a big thing. Often a lot of problems with diabetes is people are wearing shoes and the shoes are rubbing their toes. The toe is then breaking down. Now with diabetes, you often get two types of diabetic lesions. So one is called a vascular lesion, which is very sensitive and painful, and the other is called a neuropathic. And with neuropathic diabetic lesions, they often don't feel pain. So we will see in our clinics someone with a nail stuck in their foot, which has been there for several weeks, which they've not been able to get down to, or not even realize has been there. When we take this out, this will cause tissue necrosis and breakdown. And this is one of the biggest worries we have, that a patient who lives on their own, is elderly, hasn't got support, will end up with an amputation of their foot or lower limb because something that was there that they had no knowledge of. So it's very, very important in having that sort of pre-care and understanding about things. But all of this information is on our college website and anyone can access it. And we have yearly Foot Health Week where we try to promote and go out not just to schools but to centres, talking to everybody about what we can offer them.
Thank you.
Thank you. Got another question. You've kind of answered it, but it's all about, if you could share some tips for maintaining good foot health and preventing common foot issues, and where can that be easily accessible?
Royal College of Podiatry website. No, absolutely. It's a fantastic tool, and everything that we do as a college has gone through a lot of evidence-based. There's a lot of consultation. Medicine is all about now doing clinical guidelines. So it's very important for us to have a shared version of those guidelines for everyday people. So it's in a form for them to actually take on tips very easily.
Thank you very much.